Minister, pardon me, I will start with you and ask maybe Corinne to follow and then Camille. You touched on this actually a little bit, and but I'm wondering, how will you ensure that dementia education is improved and delivered? And I will emphasize and delivered across all long-term care homes.
Well, as you know, we've got to continue, and we have a very successful PIECES program that addresses dementia education for clinical leaders. We're also working with the Alzheimer Society to build out a broader program, the U-First Dementia Education Training Tool, for all long-term care workers, because really much of direct care, of course, isn't by doctors and nurses. It's provided by healthcare assistants who, because they work every day with people living with dementia, have extraordinary knowledge, and they have a lot to teach us. But there's also a standard of care that has to be taught across long-term care. I would add to that, I think that we need better education through the community. We've described long-term care, so those programs are excellent, and we need to expand them out. Absolutely, and continue to develop those so that everybody receives them, because that is the work of long-term care. I think the recent Seniors Advocate report said that 72% of people in long-term care are living with Alzheimer's or other dementias. So that's a significant number in long-term care, but also more broadly in society. Ambulance paramedics and police officers, civic workers, and people who work in community centers are existing training, which is good through long-term care system and can be better, but is good right now, can be used to balance that out through society, because the vast majority of people, of course, are dealing with community health workers if they're working with the healthcare system, or nurses in community, or community agencies that may not be specifically dealing with issues of dementia, but are supporting seniors and others with long-term care, including much younger people who are living with dementia, people living with dementia who are younger in communities. Finally, I think that education has to be in multiple languages through the community, and that's part of the work that the Alzheimer Society has really led on. I know programs in Urdu and in Hindi and Punjabi and in Mandarin, Cantonese, and other languages from you. And then you see that in our programs, adding other languages such as Vietnamese and Korean, which are so important to that. We need to support those programs in community and then provide proper education about those programs. It can be transformative in a society to do that. And those are some of the things we need to do to improve dementia education across BC.
I'll hop in there. Thank you for that. I mean, I agree with what Minister Dix is saying. There is this education. It needs to be baked into all of the contracts that we have as an expectation of what healthcare providers are going to be providing in long-term care. I understand that most doctors now they've done a lot of work in terms of being aware of dementia. And I think just the early onset dementia with young people here is that people aren't as aware of that, and there does need to be more training in terms of how to identify that. But I otherwise just agree with Minister Dix on that.
Yeah.
Thank you. Well, isn't it lovely to have a question where I think that we actually do all very much agree on this one. And I would give a nod to your association for this. So I really appreciate this kind of question coming from your group, because it is you guys that we have witnessed that are working so hard to increase education in our society as a whole. As was just alluded to, I spent a bit of time on your website as well, looking at the information that you have available to medical practitioners. And it just made my heart totally fill with joy to see the information that you're putting out there and making it so accessible. I do agree with Minister Dix that we need to always be taking into consideration linguistic needs. And so we need to be looking at all the different options and languages that we can offer that in, because again, when we go back to the hundreds of thousands of people that are the caretakers for individuals outside of facilities, we need to ensure that the materials are readily available in their first language. So one of our goals would be, just like the other two that have shared before me, it really is to empower organizations like the Alzheimer Society to keep up their amazing work. You guys also have your finger on the pulse on a lot of research stuff, and as well as firsthand accounts and experiences, right? Societies like yours that come together with people that have been affected or people that are taking care of those that are affected are absolutely our best tools for making sure that we're hitting the mark on what we need to provide. So we will look to support organizations like yours and other organizations that specialize in dementia. And what we'd like to see is a continued development on comprehensive resources and also furthering ongoing workshops and developing training programs for staff. Your campaign that you are running to reduce stigma on Alzheimer's is once again amazing. So we would want to continue to support that because I think it is one of the key tools to achieving the early detection. And that's what I think a lot of these questions are coming back around to as well. Is the reason for education is so that we can do early detection, so that we can give people more time to plan for what their future is going to look like, and so that we can reach them and really provide treatment options sooner, and hopefully even diminish symptoms or alter the effects that the disease may have on them when it's caught at a later time. So my last note on that would just say that the reason I feel actually so passionate about this question too is because I myself as well run an organization based on patient advocacy. And what I witnessed through BC Healthcare Matters is also how providing the public with information can truly encourage the public to become part of the solution. And I think that's what we really are all looking for right now is how do we bring our community and society together? And what I have witnessed through my organization is that we can achieve that. There's the potential to do that. And when we do that, we bring down barriers, we build relationships, and we really do foster communities who are able to step up for each other. And that's what we need right now is everyone stepping up for each other. So thank you again for that question. And thank you so much for the work you guys have been doing.
Thank you.
Yeah.
Thank you for those comments. Sorry, Jim.
Yeah,
I think we're both excited about being like, yes, thank you. And also appreciate the threads that have been brought up in all three of your responses around just the broader applications on education, but also I want to pull on a thread that's come up in the comments here as well. The global report on dementia, which was just released over the weekend, indicated that prevalence of beliefs among healthcare professionals, specifically 65% of medical professionals believe dementia is a normal part of aging. That goes to that thread we've been talking about, the importance of dementia education for our healthcare providers, but also